Welcome to Desert Chat, Dr. Corzano.
Hi.
Nice to have you here. We love our friends at Desert Oasis Healthcare. And you know, not only are you an MD, but you're also a Ph.D. So talk to me about that choice and how that kind of informs your primary care practice.
Yeah, thank you for having me, Sandy. So I got my Ph.D. in molecular and structural biology from the City of Hope. I did a lot of cancer research there for about 5 years. And so as a researcher, you're supposed to, understand how things work, you become an expert in your field, but you're also supposed to be able to teach it, teach
right.
back.
Sure.
And so I kind of felt like having those skills before I went to med school really kind of helped me because as a primary care doctor, you're supposed to not just, diagnose and treat, but you're also supposed to be able to educate your patients on their diagnoses in like different levels, right? They all come from different education levels, different backgrounds.
Right.
And so it's actually one of the things I enjoy the most about what I do, because in the rooms I actually get my Sharpie out and start drawing things out for them. And so like having that teaching background has really like helped me become a way stronger physician than I thought I would be.
And you just recently did a podcast because you have your brand new DOHC podcast. You did it with Dr. Adams, who was a recent guest here as well. So talk to me about how that really helps the community learn more about you also.
Yeah, so Desert Oasis just started the podcast, and we were on episode 3. So if anybody wants to check it out, it's DOHC podcast on YouTube. And so Dr. Adams and I, we did it in June, which happens to be Pride Month, and also Men's Health Month. So we ended up doing this episode basically combining the two. And so one of the things we talked about was, having early detection and prevention as it applies to like men in general, but also like very specific needs in our gay community.
Sure.
And one of the things that we really talked about, which I'm actually very passionate about, is having these sexual activity conversations, because it's very important for your patients to be able to trust you.
Yes.
And I think that it's something patients should really be seeking providers who are willing to have these like open and honest discussions with them about things like that.
Nice, that's so important.
Yes.
And DOHC really, I think your mantra is kind of, of the community. You really make sure that you really spend time in the community, you serve the community, you care about the community. Do you find that that's a really welcoming umbrella?
Yes, and in fact, Barry, I think whom you know, he's actually trying to like incorporate more of us to actually do more things in the community. Like he started getting us to actually be part of the Pride Parade and all that stuff. So it's been really good, and the community is actually, very welcoming of us too.
Nice. And so we want to remind our viewers, you're bilingual.
Yes.
You're taking new patients.
Yes.
Primary care physician.
Yes.
Also a PhD.
Yes.
And so where can they find more information?
I would say go to mydohc.com.
Great. Thank you so much
Of
for
course.
visiting us.
Thank you for having me.
Thanks.
Thank you.